The person who receives care in America generally doesn't care how much it costs, because once they've paid their deductible, it's free. And the provider, the more they do, the more they get paid. We have something that's not working like a market. It's working like a government utility. And so what we have to do is make sure that individuals have a concern and care about how much something costs. And for that to happen, health savings accounts. Give people a stake in what the cost of insurance is going to be, what the cost of care is going to be.
Governor Perry, you're a firm believer in states' rights. Can a state like Massachusetts go ahead and pass health care reform, including mandates? Is that a good idea, if Massachusetts wants to do it?
Well, that's what Governor Romney wanted to do, so that's fine. But the fact of the matter is, that was the plan that President Obama has said himself was the model for Obamacare. And I think any of us who know that that piece of legislation will draw a line between the doctor-patient relationship that will cost untold billions of dollars is not right for this country. And frankly, I don't think it was right for Massachusetts when you look at what it's costing the people of Massachusetts today.
You're a physician, Ron Paul, so you're a doctor. You know something about this subject. Let me ask you this hypothetical question. A healthy 30-year-old young man has a good job, makes a good living, but decides, you know what, I'm not going to spend $200 or $300 a month for health insurance because I'm healthy, I don't need it. But, you know, something terrible happens. All of a sudden, he needs it. Who's going to pay for if he goes into a coma, for example? Who pays for that?
In a society that you accept welfareism and socialism, he expects the government to take care of him.
What do you want?
But what he should do is whatever he wants to do and assume responsibility for himself. My advice to him would have a major medical policy, but not before.
But he doesn't have that. He doesn't have it, and he needs intensive care for 6 months. Who pays?
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
But Congressman, are you saying the society should just let him die?
No. I practiced medicine before we had Medicaid in the early 1960s when I got out of medical school. I practiced at Santa Rosa Hospital in San Antonio, and the churches took care of him. We never turned anybody away from the hospital, and we've given up on this whole concept that we might take care of ourselves, assume responsibility for ourselves, our neighbors, our friends, our churches would do it. This whole idea, that's the reason the cost is so high.
Congressman Bachmann, go ahead and weigh in on this hypothetical 30-year-old who needs 6 months of intensive care, has no insurance.
Well, first of all, what I want to say, with all due respect to the governors, I've read this health care bill. I've been fighting this fight the last couple of years. President Obama's Obamacare bill. And waivers and executive orders won't cut it. If you could solve Obamacare with an executive order, any president could do it and any president could undo it. That's not how it can be done. Plus, no state has the constitutional right to force a person as a condition of citizenship to buy a product or service against their will. It's unconstitutional, whether it's the state government or whether it's the federal government. The only way to eradicate Obamacare is to pull it out by the root and branch to fully repeal it. It's the only way we're going to get rid of it, and this is why I'm running for the presidency of the United States, because 2012 is it.